Hi, thank you for coming. This is our first of what's likely to be quite a number of federal affairs briefings over the coming months. And let me just warn you that there's a lot going on in Washington that's impacting us here in San Diego County. So please expect that this briefing is going to be longer, most likely, than our average press conference. And we're happy to send you all of this information if you don't have it already. I know it should be in the press briefing materials we already gave you. Federal directives are already disrupting essential services in San Diego County with a suggestion that even bigger cuts are looming on the horizon. I'm going to be walking through some key areas where announcements made by the Trump administration have impacted our operations. But first, I would like to highlight just how interconnected our county's services are to the decisions made in Washington, D.C. San Diego County depends on federal funding for everything from emergency responses and public health to housing assistance and behavioral health care. But let's be clear, these are not handouts from Washington. Local San Diegans pay billions of dollars in federal taxes every single year, and that money is meant to come back to our community to fund essential services. Over $1.3 billion in our county budget is funded through federal sources, and when those funds are blocked, delayed, or cut, it's San Diego taxpayers who suffer the consequences. Right now, Trump administration directives are already disrupting our operations, and the purpose of this federal affairs briefing is to inform the public regarding the specifics. Let's begin with disaster relief. Disaster preparedness has always been one of our top priorities here in San Diego County. When wildfires, floods, and other disasters hit, our region steps up, mobilizing first responders, protecting communities, and coordinating emergency relief. We rely on federal partnerships to fund and reimburse disaster response efforts. FEMA's disaster fund allows local governments to recover the costs of emergency response, evacuation shelters, and infrastructure repairs. Year-round, our emergency teams work to strengthen wildfire preparedness, maintain flood control systems, and ensure we're ready for the next disaster. So FEMA funding is vital to our ability to respond and recover from disasters. The way it works is that when the disaster happens, the county pays for emergency costs up front, expecting FEMA to reimburse us, like they have always done for communities across the country. This is not a favor from Washington. These are our tax dollars meant to help us recover from disasters. Our families and businesses pay into this system. FEMA disaster relief supports debris removal, reimbursements for sheltering, evacuation costs, rebuilding efforts. As of today, FEMA has placed financial holds on all open disaster relief grants and continues to withhold funding in violation of a federal court order requiring these funds to be reinstated. Specifically impacting San Diego County, FEMA has frozen funding for its Shelter and Services program, which provides emergency shelter for asylum seekers and newly arrived migrants. The administration has also clawed back Shelter and Services program funding awarded to other jurisdictions. Without this funding, shelters in San Diego have already closed, forcing more people onto our streets and increasing pressure on San Diego's homeless response system. The county has received no confirmation from FEMA on when or if these funds will be released. FEMA's failure to act does not just hurt San Diego County, it sets a dangerous precedent for every local government. When disaster strikes, we do not want government bureaucrats suggesting that our emergency responders should hesitate to save lives because of concerns that we will not get reimbursed. When homes are destroyed, when families are displaced, when entire communities are left struggling after a wildfire or a flood, FEMA is supposed to be there, and we need to be able to trust that they will be there. So it's not just our emergency response work that is uncertain. There are also current situations that have been unfolding regarding our public health programs. San Diego County's public health team works every day to track infectious diseases, respond to public health emergencies, ensure residents have access to life-saving programs. The Centers for Disease Control and Prevention, or CDC, is one of San Diego's biggest public health partners. Right now, federal funding helps train public health workers to respond to emergencies and keep our communities safe, prevent tuberculosis outbreaks through screenings, treatment, and community education, and provides support and treatment for HIV and STD programs. Right now, the future of public health funding is uncertain. At least $30 million in our county's CDC-funded programs are under review and could very well be eliminated altogether. To date, the CDC has issued conflicting directives, first ordering certain programs impacting San Diego County to be shut down, then reversing course, and now refusing to speak to us. This back and forth is creating chaos as we try to make a plan for our public health program. Adding to the uncertainty, the CDC has ordered a communication stoppage with the county on key public health initiatives, including the tracking of disease outbreaks and the coordination of emergency response. Communication is key in protecting public health. If this funding is cut, we lose critical disease prevention programs, making it harder to stop outbreaks of tuberculosis, HIV, and other serious infections. Next, I will speak about the ongoing pollution crisis in the Tijuana River Valley. San Diego County has been leading efforts to clean up pollution in the Tijuana River Valley, as it is both an environmental and public health crisis. We've worked alongside our congressional delegation to secure federal funding for wastewater treatment upgrades and emergency pollution mitigation. We formally called for a federal state of emergency to cut through red tape and get construction and permitting moving faster. We have been exploring legal action against responsible parties, including international contractors, and our Air Pollution Control District is actively monitoring air quality, investigating reports of hazardous odors, and providing air purifiers to mitigate health impacts from pollution. We've also launched major public health studies to understand how this pollution is impacting our communities. Federal agencies have been and must be critical partners in this work. The Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry, the CDC, and the ATSDR sent their public health experts to conduct studies and provide recommendations. Federal funding supported 2 recent health assessments. One study, the Community Assessment for Public Health Emergency Response, called the CASPER, has been surveying residents about health concerns. Another study, the Assessment for Chemical Exposure, also known as the ACE, was designed to examine whether people in affected areas had been exposed to harmful chemicals from the river pollution. This federal partnership for both the ACE and the CASPER has now been put on hold. The CDC is no longer speaking with the county about next steps regarding the CASPER, and without this coordination, we do not know what the results are or what steps will come next. The Agency for Toxic Substances and Disease Registry has informed us that they cannot provide the results of the ACE study, although it was completed back in November. The ATSDR has also paused a second study that was slated to take a deep look at soil, water, and air quality contaminants in the Tijuana River Valley. San Diegans deserve to know if our health is at risk. These 2 studies were launched to get answers, but now that information is being withheld. Without federal communication, our ability to act is severely limited. We cannot push forward on mitigation projects without data, and we cannot protect the safety of impacted communities without federal engagement on this trans-border pollution crisis. Next, I'd like to speak about housing in San Diego County. We, as a county, have made major investments to tackle homelessness and make housing more affordable because we know this crisis will not solve itself. We've worked to secure more rental assistance, fund new affordable housing developments, and make sure the most vulnerable residents have stable housing. Through some previous federal partnerships, thousands of families, seniors, and people with disabilities in San Diego County today have a roof over their heads who otherwise would not. Federal grants also fund emergency rental assistance, allowing shelters to stay open and providing support for people moving off the streets into permanent housing. Specifically, federal funding helps tens of thousands of families afford rent in San Diego County each month so they don't fall into homelessness. These are our local tax dollars that have been paid to the federal government and returned to us to assist on this critical issue. These funds keep emergency shelters open, help struggling renters stay in their homes, and also finance affordable housing developments to give low-income families, seniors, and veterans permanent homes. Right now, grants to public housing agencies, of which San Diego County is one, have been paused until further notice. All trainings have been postponed and canceled. HUD web pages and resources have been taken offline. Communication has ceased. And federal housing cuts are estimated to impact and eliminate between $10 million and $30 million in funding received by San Diego County. These cuts will force the county to eliminate rental assistance for thousands of low-income families, seniors, and people with disabilities. Families on rental assistance will see their payments spike. New affordable housing projects that would have been financed with these funds will likely be put on hold or canceled. And some people will lose their housing assistance entirely, forcing them into homelessness. We know that housing assistance programs are the most effective tool we have for keeping people off the streets. If these federal cuts go through, we see more evictions, more families struggling to afford rent, and more people falling into homelessness. Next, I'd like to talk about how federal actions over the last 5 weeks are impacting our work to expand behavioral health services here in San Diego County, and what's at stake if the Trump administration and congressional leaders change course on Medicaid funding. In San Diego County, too many people struggling with mental health and addiction are ending up in jails, emergency rooms, and on the streets. We've made major investments to make sure people get the right care before a crisis happens, expanding mobile crisis response teams, opening new crisis stabilization units, and nearly doubling our full-time behavioral health workforce. This has all been made possible because of Medicaid funding. Without Medicaid funding, these behavioral health services will disappear. Medicaid is the backbone of our behavioral health system. It's what allows us to get people mental health treatment and substance disorder treatment. It keeps people out of jails and ERs. In December 2024, California received federal approval for a major new Medicaid initiative, the Behavioral Health Community-Based Organized Networks of Equitable Care and Treatment Initiative. That's the BH Connect initiative. This BH Connect initiative provides direct funding for up to 6 months of transitional rent to help people get stable housing after treatment, training for behavioral health providers so more people can get the care they need, and targeted funding to reduce racial and economic disparities in access to care. The future of this funding is now in jeopardy. If the Trump administration does not renew our approval for the BH Connect program, it's called a Medicaid waiver, we will see significantly more individuals with severe mental illness and addiction crises ending up on our streets. California's largest Medicaid transformation program, known as CalAIM, California Advancing and Innovating Medi-Cal, is also at risk. The Trump administration could renew it, scale it back, or eliminate it entirely. That decision will determine whether counties like San Diego can continue to provide behavioral health services as we are working to do today. Specifically, eliminating CalAIM will eliminate our ability to provide sober housing for homeless individuals in substance use disorder treatment programs. If we lose this CalAIM funding, we will not be able to provide sober housing for homeless individuals who are being treated for substance use disorders, which would force them out of treatment and back onto the streets. So this is not just about policy, and this is certainly not about what's happening in Washington. It's about real people here in San Diego County. If this funding disappears, people in our community will have nowhere to go. We need the Trump administration and the Republican Congress to commit to keeping Medicaid strong so counties like San Diego can continue doing our work to keep people housed, healthy, and out of crisis. Today, I've begun to outline the immediate and future impacts of federal funding disruptions on San Diego County as of today, from disaster relief and public health to housing and behavioral health services. We are doing our part as a county, but if the federal government does not follow through on its commitments, the consequences will be felt here in San Diego. So we are calling for immediate action. FEMA must release its disaster funding. The CDC must restore public health communication and coordination. HUD must maintain housing assistance to prevent homelessness. And Medicaid waivers must be renewed so that our behavioral health system can continue to address the needs of those in crisis. We in San Diego County have worked very hard to build a stronger, safer community, and we cannot let these federal roadblocks undo our progress. We have strong advocates in our congressional delegation. I'd like to acknowledge their work and their efforts in making the case. But even with all these efforts, we continue to face unnecessary and dangerous obstacles, delays, and political roadblocks that are putting people in our community at risks. Our residents pay billions in federal taxes every single year, and that money is supposed to come back to our community to fund disaster relief, public health, housing, and mental health services. Right now, our funds are being withheld, delayed, and redirected, and the people of this county are the ones paying the price. With that, I'm happy to take further questions. Thank you.